Work is more than just a means to earn a living, it's a central part of adult identity and daily life. After an upper extremity injury, returning to work is often a top priority for patients. Work provides structure, meaning, and social connection, but it can also bring challenges like fatigue, stress, and risk of injury. In rehabilitation, understanding the role of work in a patient's life is crucial. Therapists must recognize both the benefits and potential drawbacks of work, helping patients regain not only their physical abilities but also their sense of purpose and routine. This sets the stage for effective, patient-centered interventions. Identifying a patient's specific work tasks early in the rehabilitation process is essential. By understanding what activities a patient needs to perform at work, therapists can tailor interventions to support a successful return. This includes evaluating which tasks can be resumed, which require modification, and which may not be possible due to injury. Early planning also helps set realistic goals and expectations, involving both the patient and their employer when appropriate. This collaborative approach ensures that therapy is relevant and focused on real-world outcomes, increasing the likelihood of a smooth transition back to work. Ideal work-oriented rehabilitation setting does more than just address physical recovery. It promotes overall health and well-being while helping patients achieve their program goals. These environments are designed to simulate real work tasks, provide supportive resources, and foster a sense of community among participants. By focusing on both the physical and psychological aspects of recovery, these settings help patients rebuild their confidence as workers. The goal is to restore not only function, but also the patient's identity and satisfaction in their work life. Occupational therapy defines work broadly, encompassing not just paid employment but also activities like volunteering, job seeking, and retirement preparation. Therapists address all these areas, recognizing that work is a major occupation for most adults. The Occupational Therapy Practice Framework, OTPF, guides therapists to consider employment interests, job acquisition, and even volunteer roles. This holistic view ensures that therapy is relevant to each patient's unique life situation, supporting their engagement in meaningful activities whether or not they are financially compensated. Employers rely on their staff to perform work safely and competently, while employees are expected to meet quality and productivity standards. Both parties must navigate a landscape of laws and policies, including anti-discrimination regulations, workplace safety, and workers' compensation. When an injury occurs, employers may need to modify duties or provide accommodations, while employees must communicate their needs and limitations. Therapists play a key role in facilitating this dialogue, ensuring that both employer and employee understand their responsibilities and options for a safe, effective return to work. Upper extremity injury can disrupt a person's ability to fulfill their work roles, leading to temporary or even permanent disability. The longer someone is away from work, the less likely they are to return, which can have lasting effects on their financial stability, self-esteem, and relationships. Therapists must address not only the physical limitations, but also the emotional and social consequences of work disruption. By supporting patients through these challenges, therapists help them regain independence and reintegrate into their work and community life. When a patient is referred for work-related rehabilitation, therapists must clarify the specific questions being asked. Is the goal to restore full work capacity, identify necessary accommodations, or determine if a patient can return to their previous job? Therapists assess which job tasks the patient can perform, what can be improved through therapy, and what compensations or modifications are needed. Clear communication with the referring physician, employer, and patient ensures that everyone is aligned on goals and expectations, leading to more effective and targeted interventions. Thorough understanding of a patient's current and past medical history is vital before starting work-related rehabilitation. Therapists review diagnoses, surgeries, medications, and any other health conditions that could impact workability. Sometimes, this information is gathered from medical records, but often it requires direct discussion with the patient. Using health history checklists and validated tools like the Workability Index helps ensure that all relevant factors are considered. This comprehensive approach allows therapists to make safe, informed recommendations for return to work. Provide effective rehabilitation, therapists must understand the specific demands of the patient's job. This includes the task performed, tools used, work environment, and schedule. Resources like the Occupational Information Network (OASTERISK-NET) help therapists and patients identify key job requirements. Input from the employer and direct observation of job tasks can further clarify what is needed for a successful return. This detailed understanding guides both assessment and intervention, ensuring that therapy is relevant and practical. Therapists must be familiar with a range of policies and laws that impact work rehabilitation. These include HIPAA for patient privacy, workers' compensation laws, the Americans with Disabilities Act (ADA), and the Family Medical Leave Act (FMLA). Each policy affects how therapists communicate with employers, document progress, and recommend accommodations. Understanding these regulations ensures that therapists advocate effectively for their patients while maintaining compliance and ethical standards. Selecting what to assess is a critical step in work rehabilitation. Therapists consider activities and occupations, intrinsic factors like strength and cognition, performance patterns, and environmental influences. Tools like the International Classification of Functioning (ICF) and the Occupational Therapy Practice Framework help organize these constructs. Standardized assessments such as the DASH or Workability Index provide reliable data to guide therapy. By evaluating both body functions and real-world activities, therapists create a comprehensive picture of the patient's work capacity. Safety is the top priority during assessment and intervention. Therapists monitor heart rate, pain, and fatigue, and use safe lifting techniques to prevent further injury. Reliable and valid assessments are essential for making sound decisions about return to work. Standardized protocols, clear instructions, and careful observation help ensure consistent and meaningful results. When inconsistencies arise, therapists address them promptly, always prioritizing patient well-being over test completion. Functional capacity evaluations are comprehensive assessments used to determine a patient's ability to perform work tasks. FCEs measure strength, endurance, coordination, and tolerance for various activities. They are often used in workers' compensation cases or when legal or insurance decisions are needed. FCEs must be conducted by experienced therapists who understand both the physical and legal aspects of the process. Proper documentation, clear communication, and ethical practice are essential to ensure that FCE results are accurate and defensible. Interventions in work rehabilitation are multifaceted. Therapists may use restorative approaches to rebuild lost skills, compensatory strategies to adapt tasks or environments, and preventive measures to reduce future injury risk. Interventions are tailored to each patient's needs, job demands, and available resources. Education, training, advocacy, and group interventions all play a role. The ultimate goal is to enable patients to safely and confidently return to meaningful work, whether through restoration, adaptation, or a combination of both. Work conditioning and work hardening are specialized programs designed to prepare patients for a return to work. Work conditioning focuses on restoring physical capacity through targeted exercises and work simulations, typically over several weeks. Work hardening is more comprehensive, involving multidisciplinary teams and addressing both physical and psychological readiness. These programs use graded real-world tasks to build stamina, confidence, and skills, ensuring that patients are truly prepared to meet the demands of their jobs. Gradual, well-planned return-to-work schedule is often key to successful transition. Therapists collaborate with employers and physicians to recommend modified duties, reduced hours, or adaptive equipment as needed. Monitoring the patient's response to increased work demands allows for timely adjustments, preventing setbacks and promoting long-term success. Flexibility and ongoing communication are essential, ensuring that the patient's progress is supported every step of the way. Let's look at a real-world example. John, a 56-year-old construction worker, suffered medial epicondylitis in his dominant arm. Through a combination of therapy, job simulation, and collaboration with his employer, John gradually regained strength and confidence. By simulating work tasks in the clinic and at home and making ergonomic adjustments, John was able to return to light duty and eventually full work. This case highlights the importance of individualized assessment, creative problem-solving, and teamwork in successful work rehabilitation. Work is a vital part of life for most adults, and returning to work after injury requires a holistic, patient-centered approach. Therapists must assess not only physical abilities but also psychological, social, and environmental factors. By using standardized assessments, evidence-based interventions, and collaborative planning, therapists help patients regain their roles and identities as workers. Ongoing education, advocacy, and adaptation ensure that patients can participate fully and safely in meaningful work, supporting their overall health and well-being.